Committee on Licensing and Occupations. Welcome, everyone. I want to apologize to everyone for the time change. I hope it didn't inconvenience anyone. I especially want to apologize to Senator Mike Wilson and his constituents who there was confusion about some confusion about the time of the meeting, and they got here an hour early. I apologize to you, Senator, and to your constituents on behalf of the committee for that oversight. I did bring in some fresh tomatoes from the garden, and they're right to Senator Wilson's right in that basket. Feel free. They've been kind of picked over a little bit by leadership already this morning, but there's. I want to tell you the small ones actually have better flavor. So there's a bunch of them in there. Help yourself on the way out. Do we have any introductions? We have a packed agenda. We're going to have a hard stop at probably 12:30. No. Yeah, I saw that. I'm sorry. 11:30. Yeah. Leader Thayer almost jumped out of his chair there, and I didn't want his wig to come off. So Madam Secretary, call the roll.
Senator Adams, Senator Douglas, Senator Higdon, Senator Hornback, Senator Howell, Senator McDaniel, Senator Neal, Senator Nemus, Senator Thayer.
Here.
Senator Thomas, Representative Banta.
Here.
Representative Bratcher, Representative Birch, Representative Flannery, Representative Gentry.
Here.
Representative Herron.
Here.
Representative Huff.
Present.
Representative Cook.
Here.
Representative Massey. Representative McCoy.
Here.
Representative Meredith. Representative Miller. Representative Moser. Representative Palumbo. Representative Pratt.
Here.
Representative Santoro.
Here.
Representative Timoney. Representative Westrom. Co-Chair Koenig.
Here.
Chairman Schickel.
Present. Let the record reflect we do have a quorum and are duly constituted to do business. At this time, I'll accept the motion to approve the minutes from the last meeting.
Second.
Is there a motion? I missed the motion. Second. We have a motion by co-chair and a second. All those in favor use the voting sign of aye.
Aye.
Anyone opposed, like sign. Let the record reflect that the minutes from the previous meeting have been approved. At this time, I'd like to call forward Senator Mike Wilson. Rank has its privileges, or leadership has it in this committee. And again, I want to apologize you for the confusion on the time, Senator. You can ask your guests that are going to testify to come forward. And welcome to this committee. This is some important testimony about our small farm wineries. And I'm glad to see you all here today. Small farm wineries is an area I think that we need to do a little work in this state. So it's great to see you all. Welcome. Introduce yourselves for the record and proceed with your testimony.
I'll start. Derek Huff. I'm the Vice President of the Kentucky Wineries Association.
Joe Sloan. I'm the president of the Kentucky Wineries Association.
Don Davis, Secretary, Kentucky Wineries Association.
So I'm Brian Young. I'm the treasurer of the Kentucky Wineries Association.
Mr. Chairman, thank you so much for the opportunity to present. And you should, each one of the members, and I appreciate y'all hearing this today, should have a copy of the bill request in your folder that Bryce provided to you. And basically, the gentleman to my right immediately has become a good friend of mine. not only is he a Marine, which we share together, but he has a winery in my district, which I didn't know about. And all of a sudden I get an email, and I'm invited to be a judge at a barbecue cook-off. And so I decided, okay, well, this thing can't be that bad, I decided to go to it. And, I mean, there were people everywhere. This out in the sticks, really, is where you're at. And it was really something. I think by the time I left there, I had to roll out of there. I'd eaten so much barbecue. But it was a great event. And, of course, they have an event coming up this year. And it actually benefits returning after war veterans. Is that right? Make sure I got that correct.
Reuniting after war, yes.
Reuniting after war. And this is a feeder to the national barbecue cook-off that is sponsored by Jack Daniels, if that's correct as well. And so it's a pretty big deal for a small farm winery to host something like that. And so I've discussed with you, Mr. Chairman, that what they're looking for, and I'm going to let Derek go ahead and describe that in his remarks to the committee today, and then we'll be prepared for questions if you have any.
Thank you. Welcome again. Proceed with your testimony.
Mr. Chairman, Senators, and Representatives, I appreciate you, and on behalf of the Kentucky Wineries Association, thank you for hearing us today. The KWA represents 75 small farm wineries across 42 counties in our state. The largest challenge to our industry, and thus to all small farm winery license holders, is that of representation in our local restaurants and retailers. Because we are farmers first, the majority of small farm wineries are located in very rural areas. As a result, it's very difficult to find a wholesaler who will drive all the way out to our farm to buy our products. This means that Kentucky small farm wineries largely do not have representation on the shelves of our retailers. Self-distribution would allow small farm wineries to sell a portion of their products directly to retailers and restaurants in our hometowns. Our legislature has already recognized a wholesale issue within our small farm and craft section of the beverage industry in Kentucky. In 2021, Senate Bill 15 was signed by the governor, which granted microbrewers the ability to self-distribute a percentage of their total production due to the same logistical barriers which burden their industry. That bill has now paved the way for microbrewers to represent their products directly to retailers, lifting that undue hardship. Small farm wineries in Kentucky deserve the same ability to represent our products to retailers directly. The bill presented today will remedy this issue, and we appreciate your consideration of this bill and the positive impact that it will have on the wine industry in Kentucky.
Well, I appreciate your concise testimony, and members, the bill is in your folders for your inspection, and I would encourage you to inspect it. At this point, I'm going to ask, is there anyone in the audience who has a different point of view about this legislation? Okay. Come on forward there, sir. Have a seat. Have a seat on the front row. You're not going to testify just yet. Do you all have any more testimony? Let's do question. Well, let's have Charles George.
Can I interrupt?
Yes, you may.
I've been in discussions with Mr. George about testifying, and I think this would be one of the topics that he would talk about at a future meeting. So I don't know if you want to plow this ground twice, Mr. Chairman, or it's up to you.
Did you say you have him on the agenda at one of your meetings?
We've talked about this topic happening in November, and his organization kind of talking to this. So it's whether you'd like for it to the two of you, whether you want to do it now or in November, I'd say.
We can defer to November. I think that's probably reasonable. Are there any questions of the testimony? Representative McCoy.
Thank you, Mr. Chairman. the part about notifying the distributor of any distribution, any self-distribution, is two things. Number one, why? And secondly, what?
Representative, if a small farm winery already has an existing relationship with a wholesaler, a distributor, it would be expected that would continue as long as they have that relationship. If a small farm winery, a license holder, does not have a relationship with a wholesaler, which most do not, then they would be reporting directly to the ABC instead of to that wholesaler.
Yeah, but the way it's written, it looks like you can sell up to 30,000 gallons directly to a retail license holder as long as, one, they're not otherwise registered, and two, you notify the wholesaler. So it seems to be a mandatory requirement. I don't know which wholesaler you're going to have to notify. I'd look at maybe tweaking that a little bit. The next question, I only bring this up because it came up when we were doing direct ship on alcohol.
Proceed.
Thank you, Mr. Chairman. Sorry, sir. I had one follow-up question, if I may. Is what are you going to have to tell the distributor? Do you have to give up the volume? Do you have to tell the product? Do you have to tell the price? And which leads me back to the ultimate question of why are we bothering with the distributor anyhow? They're not involved in this particular transaction. You may have a contract otherwise with one of the clients, and great, you need to follow your contract. But if you don't, I don't understand why they need to know. Just food for thought.
Thank you.
Anyone else? Any more testimony? Very well. Yes.
No, sir, I don't believe we have any more testimony. I have noted what Representative McCoy said, and we will discuss that and see how we can tweak that.
Very well. And Mr. George, since you are on the agenda for November, we'll defer your testimony till November. Thank you all.
Thank you, Mr. Chairman and members of the committee.
We have Christopher's Law next on the agenda, and I want to just point out right away that I am not a fan of naming legislation after people, but we'll take that up later on. But Leader McGarvey is going to handle this legislation, and he notified me that he is running a bit late. So out of a courtesy to him, we are going to defer that and take that up a little bit later on for all of you who are here for Christopher's Law. As I'm sure you all hear the babies crying, and that's because our friends from the birthing centers are here. Is Jason Nemus here?
I saw him in the hall.
Okay. Jason, you're up.
Thank you, Senator. I'll start as people are coming to the table. I know time is limited today. I want to thank you for giving us the opportunity to talk about birthing centers in Kentucky. They are in the overwhelming majority of states, and it provides a safe middle option for mothers to have their babies. That some of them want to have at home, some of them want to have in the hospitals. And Representative Herron, you and I know a lot of people in Louisville who just track that 15 seconds over the bridge and use the birthing centers in Indiana. So we would like to make that available to Kentucky moms to have their babies here in Kentucky in a birthing center. So with that, I'll turn it over people for them to introduce themselves and have a few remarks, and we can answer any
I
questions.
want to welcome this group here. I've dealt with them a lot over the years, and it's always been a joy. Actually, one of my favorite topics, so welcome, and it's great to have the little ones here too today. Introduce yourself for the record and proceed with your testimony.
Mama to mama.
It's called Mama to Mama?
Yes.
Okay.
Christy Peterson, APRN and Kentucky licensed nurse midwife.
Renee Basham, Executive Director of Hope's Embrace.
Jennifer Hawkins with the Kentucky Birth Coalition.
Thank you for hearing us today. So just as I just mentioned in my introduction, I'm a Kentucky licensed APRN and nurse midwife. I have a home birth practice. on the Kentucky-Tennessee border, serving several counties. And I'm also nationally involved with the American Association of Birth Centers and the CABC, which is the accrediting organization for birth centers. I chair the Standards Committee, which sets the national safety standards for freestanding birth centers across the United States. And so you may be asking, what is a birth center? Birth centers are healthcare facilities for childbirth. They offer a home-like setting for families where they can receive maternity care, prenatal and postpartum and newborn care with appropriate levels of interventions. These facilities are not hospitals, and they don't offer C-sections or anesthesia. So care is provided in the midwifery wellness model. We use an informed consent and shared decision-making with our clients. We provide risk screening. That's actually a key component of birth center care throughout the pregnancy, labor, and birth to ensure that each patient is a appropriate birth center candidate. And so there's multiple studies that show that birth center care is safe, cost-effective, and leads to good outcomes when the care is provided according to the American Association of Birth Center standards that I previously mentioned. And so birth centers were actually one of the enhanced care models that was studied in the Strong Start for Mothers and Newborns initiative that was sponsored by the Center for Medicaid and Medicare in 2013. It was a 4-year study, and it showed a reduction in preterm birth rate, low birth weight, C-sections, and it was estimated that birth center care saves Medicaid $19 million per 10,000 births just from the facility payments for C-sections prevented. So we think it's a great model. There is a demand, and you'll hear more about that from some of our other speakers.
Thank you for your testimony. Proceed. We have a standing tradition in this committee that no one testifies to anything that someone else has testified to. But if anyone has new testimony, please introduce yourselves and proceed.
Good morning. My name is, again, it's Jennifer Hawkins. I live in rural Mee County, which is about an hour southwest of Louisville. I am a mother of 3, and I am currently due with my 4th in October. I plan to deliver at the Tree of Life Birth Center, located in Indiana, which is directly across the river from Louisville. With my first child, I delivered at a hospital with an OBGYN. I was in active labor for over 18 hours. I was able to birth naturally without any major complications or without any medications. I then chose to have my second child at home with a midwife in order to have a more natural and comfortable environment. This allowed me to better relax and focus on my labor for pain management and the natural progression of labor. My third child I had with a group of midwives, but this time in a hospital setting due to my previous midwife retiring and no other midwives cover Mee County home births. Again, I was able to deliver naturally without any medication or major complications, but was still lacking the natural and comfortable environment that I desired. So therefore, with this delivery, I am choosing to forgo the option of the most convenient and nearest hospital to me located in Kentucky. I will be traveling over an hour across the state line and past 2 other hospitals to deliver at a birth center in Jeffersonville, Indiana. I have chosen this so that I can labor in the most effective way possible in a natural and comfortable environment. However, I am fortunate I do have the transportation and the support to travel over an hour away from my home. I'm fortunate that my insurance is accepted by this out-of-state birthing center, as they accept very few insurances, including Kentucky Medicaid. Approximately 50% of the clients that have given birth at this birthing center are women who have traveled across the state line from Kentucky. Therefore, women of Kentucky need more birthing options. Thank you.
Good morning. First, I would like to thank you all for the opportunity for me to be here in this space to speak about the importance of birth centers. I would also like to highlight the importance of me being here because Black women need to be included in every single conversation about birth and any initiatives that are being put in place to make birthing equity more accessible. As a current midwifery student, having the opportunity to have a birth center in the community that I will serve will be monumental. The more and more Black women and women of color learn about the climbing rate of maternal deaths that plagues our community, the more and more we are searching for alternatives to birth our babies. There are so many barriers around home births from women who look just like me. Having a birth center right across the bridge in Indiana isn't obtainable for most because they do not accept Kentucky Medicaid. Birthing in their own homes may not be ideal because their home setting isn't one that will foster a fitting setting to bring forth new life. Choosing where you give birth should be a right that every birthing person has the opportunity to exercise, whether that choice be a birthing center, at home, or in a hospital. The maternal mortality rate in the state of Kentucky is alarmingly high. I personally feel as though it is indicative that a change needs to be made to incorporate different models of care surrounding how and where birth should take place. Thank you.
You're welcome.
And then finally, I am the executive director at Hope's Embrace. We work with about 85 to 90% Medicaid population. And we have tried to open a birth center through various avenues. We've met with attorneys about certificate of need. We've talked to mortgage brokers. We've talked to realtors. And it's kind of all this chicken and egg situation of you can't do this before you do that, but you can't do this until you also do that. And so just kind of getting rid of that barrier to open a birth center for low-income women is what we're looking to do.
Thank you, Mr. Chairman. I think that's our presentation.
Well, it's a good presentation. I have a few comments. I've met with several groups in my district on this topic, and I support this legislation. I just want to say that right up front. Is there anyone here from the Kentucky Medical Association or the Kentucky Hospital Association? I want to notify, yes. Okay, good. Come on up here. I want to tell them, both those organizations, that if they have concerns about this legislation, because I know they have in the past, let's get it out before session. So with that, you're at the table, and you don't have to testify today, but you're welcome to if you would like.
Thank you, Mr. Chairman. We had not signed up to necessarily speak. In fact, we're open to hearing more about this legislation. We've heard comments from Representative Nemes in the past. I know this bill's been introduced. Of course, we work very closely with the specialty society who's most directly impacted by this, which would be our OBGYNs. We've had conversation with them about this legislation. And based on what they have told us up to this point is that they very much support options for women and how they choose to birth their children. And so I know that they've had conversations about this legislation over the last 2 or 3 years, and what they have said is that with some modifications, which I think up to this point have been incorporated, which is incorporating the appropriate standards, the appropriate accreditation standards, that they would very much be open to this. We do have a couple of things that we'd like to talk to the sponsor about, and that is in those standards, would there be a medical director of the birthing center, and if so, who would be eligible to be the medical director? Of course, we would prefer that be a board-certified OBGYN. And in all honesty, I'm not sure what those standards say about that, so we just had some questions that I'm sure can be answered along those lines.
Okay, thank you.
Sure.
First, could you identify yourselves for the record? We all know
Sure.
you, but you failed to do
Sure,
that.
absolutely. My apologies, Mr. Chairman. I'm Corey Meadows. I'm Director of Advocacy for the Kentucky Medical Association.
Like I thought, all of a sudden we have a bunch of comments and questions. You opened up the floodgates there with your comments, and I think the reason you opened up the floodgates with your comments, at least in my mind, is that, again, let's make sure that we have thorough discussion long before we go into session, because what's been the history of this is we get into session and then all of a sudden the sky's falling. So let's make sure we have thorough discussion long before we get into session. With that, Representative Miller.
Thank you, Mr. Chairman. I'll be brief. I just would like to ask anyone on the panel if they could comment on what would be the impact on the cost of Kentucky Medicaid if they opened up coverage for birthing centers, and if anybody's got any experience with Indiana birthing centers.
So as I mentioned, the Center for Medicaid and Medicare did a 4-year study showing that birth centers did reduce cost. The initial cost evaluation was around the reduction in facility fees, specifically related to the reduction in the C-section rate. However, there are additional reductions in costs because birth centers, when they take care of low-risk women, are also offering early discharge rather than the typical 2 to 3 day hospital stay. And so there are also a reduction in costs with that as well. So the $19 million per 10,000 births was specifically related to the facility payment. But the reduction in things like preterm birth and low birth weight also reduces NICU stays, which is a major cost factor for births as well.
Want to note it also would save the Kentucky taxpayer money because the woman who wants to have her birth in Indiana, but she can't pay for it, or she either has to pay for it out of pocket or that's not an option for her. As I think Ms. Bryant testified, Indiana obviously doesn't take Kentucky Medicaid. Thank you.
Senator Adams.
Thank you, Mr. Chairman. Well, Corey answered one of my questions, which was, could this model help with our OBGYN provider shortage in the state? And I'm really happy to hear his quick testimony. My question is, I've done a lot of work with pregnant women who are suffering from substance use disorder. And correct me if I'm wrong, but I understand that this model of a birthing center is really beneficial to those women who are in recovery from substance use disorder. Am I correct in that thinking?
Yes, thank you for bringing that up. That's a really important topic. Someone with active substance use disorder would not be a candidate for birth center care, but someone who's recovered or no longer using would be a good candidate. And the great thing about birth centers is because they're not offering narcotic pain management during the delivery, then you're reducing your risk for re-exposure or becoming addicted again. And so birth centers are a great model for people who are wanting to avoid interventions that are going to increase their likelihood of becoming addicted.
Thank you very much.
Representative Flannery, and then Representative Banta will be after that.
I have 2 questions, Mr. Chairman.
Proceed.
I'll ask Representative Nemus the first question. Are these facilities staffed by midwives only, or is it a midwifery practice, or are there physicians on site typically?
I think the best person to answer that question is at the end of the table, and I'll ask her to supplement. But well, in the states that have them, there's a variety of ways to do it. And the one thing I want to impress upon the committee is we're not inventing the wheel here. There are well over 40 states that have already do this, and they do this very safely. You want to answer the question directly?
Yes, that's correct. And so birth centers across the nation have a variety of staffing models. They are in the midwifery model of care, in the sense that they're offering informed consent and discussion with their clientele. But there are midwives, there are OBs, there are nurses, there are birth assistants. There are many different types of providers in the birth setting. And so the model of care, it does not exclude OB care. And so OBs can own birth centers. Hospitals can own birth centers if they so desire. The birth center in Nashville is owned by a hospital. And so this does not exclude options if hospitals wanted to start birth centers to add an additional service line as well. And so the staffing can be midwives only. It can be midwives and
Thank
OBs
you.
in a collaborative model.
I guess my concern on that would be that things unexpected could happen in delivery when you have a woman in delivery, and I just would want to be sure for protection of the patient that there's adequate specialists on site. Second question is for Representative Nemus. I think he could probably address this one. They're starting on paragraph number 4, it addresses liability. If you could maybe
Yeah, I don't have
amplify it addresses. It says it's not intended to expand or limit liability, and then it goes through with several sentences. I don't know if you could maybe clarify what all that's supposed to address.
Well, I don't think we're intending to change the opportunity, the ability. Thank you. I didn't have it in front of me. I do now. I know this is something that's important to you. It's important to me as well, to make sure that we're not having tort reform in various places, and so to speak. I don't know if we have time to read it now. I'm getting ready to get pushed by the chair, but I'll answer that question offline if I might.
That'd be
Is that
great.
fair?
Thank you for being so understanding.
I caught your eyes, Mr. Chairman.
That's okay. We're doing pretty good on time, and I'm happy. Representative Vanta has taken herself off the list. You're always allowed to do that, I might point out to the members. Take yourself off the list. There's no problem with that at all. So the next is Representative Mosier.
Thank you, Mr. Chairman, and thank you to all of you for coming and talking to us about this today. I've had lots and lots of meetings about this. We've really tried to dig into any issues that are really problematic. And I appreciate all of the work that you all have done to address any of those concerns. As a former NICU nurse and neonatal transport nurse, I understand the importance of a transfer agreement and a connection to the hospital. I haven't read the most current iteration of this bill. We just got it, so I will. But what sorts of transfer agreements do you see in the model that you're proposing?
Thank you. That's actually really important because safety is part of the gold standard for birth centers. And so our transfer agreements are part of they're addressed in the standards for birth centers. And if you're looking at the proposed legislation, it has a requirement for birth centers to meet those national standards. And also the accreditation standards also outline those different transfer agreements that we would have with our emergency services and our transferring hospital and those who are going to be accepting transfers. And so that by meeting the national standards and the accreditation standards nationally, then Kentucky Birth Centers would have those specific transfer agreements that create safety.
Okay. Mr. Chairman, if I may just make a quick comment.
You may.
Thank you. I appreciate that very much. We had some good meetings last year or last something. I don't
Right.
know. We've been talking about this for a while with Vanderbilt, and I like their agreement. They're very closely linked. It provides women and families an alternative to giving birth in the hospital, but there's still a strong connection for safety reasons. And that's really important to me. I think that is that may even outweigh, the comfort of the woman. I've given birth 5 times. I understand why it's important, but I also really understand unforeseen problems that come up, and they come up quickly. And so, there's a good reason to have that strong connection to the hospitals. And we have done a lot of work with you all, the lay midwives, on creating standards and certifications. And I think that, this is a direction that we need to continue as we're talking about this. So, if we can get a good partnership with, a hospital system, I'm not sure that it would solve a problem for rural women necessarily, because some of these would be more urban. I don't know. We can talk about that, but that's what would give me comfort in supporting this.
I think too now would be a good time to add that if you haven't done so already, I think you should request an interim hearing in front of the Health and Welfare Committee, because I think that would be a good thing to do.
Thank you.
Mr. Chairman, if I could just really quickly, I would note I'm not a birthing person, no matter how much I might want to be in the future. I'm not. I've never. You've given 5 deliveries. I haven't, and never will. But I understand how important safety is. Obviously, the national accreditation standards address that issue. But I would also note that this is you were a leader in the home birthing situation a few years ago, where we expanded access there. This is safer than that, which is designed to be middle ground. And I also believe that anytime we need those agreements with hospitals or understandings with hospitals, but if care is needed, EMTALA would already cover it. I think the emergency. I don't remember what EMTALA stands for. In my legal world, we just say EMTALA. I think that already has some standards put in there, but the national accreditation standards on birthing centers do apply. Got it.
Has there been a hearing in the health and welfare on this?
We're seeking one through my good friend Representative Mosier.
Representative Birch. Speak up and turn your mic on, please. We got the question. Do we have an answer?
Yes, and so now that Kentucky has recently licensed certified professional midwives, Kentucky itself is also gathering statistics on outcomes on an annual basis. That is one of the requirements for licensure. And so the state does have those outcomes because one of the difficulties in the past has been tracking through birth certificate data, which is less helpful because someone could have a birth outside the hospital by accident and get lumped into the home birth, and so by tracking it through the licensure through the state, they're able to look at those data. However, licensed professional midwifery is new in Kentucky in the last 2 years, so it's minimal amount of data available.
So you're going to get us that answer? Or?
Yes.
Okay, great. Representative McCoy.
Thank you, Mr. Chairman. Real quick, I see this legislation requires them to pass regulations. Is there anything up here, Nemus? Anything in the law that prohibits these from existing right now?
So the law, Kentucky law, has it on the books. The CON application has been very cumbersome, and there's only one application that has been applied for, and it was not granted. And so this would make it easier to become a birthing center in Kentucky. There is a law on the books, but it is not workable, so no one applies for it because it's so unworkable.
And the last question, Representative Westrom.
I just wanted to say that I've been here long enough to see very many medical professions that have expanded their practices under the guidance of the KMA. And I'm talking about PAs, ARNPs, midwives, nurse practitioners, so many that have really, their legislation has been perfected working with the KMA. And I really love the alliance you have formed with the leaders in the medical profession. And I do hope to see this bill pass in 2023. Thank you for your hard work.
We'll conclude with that. Great testimony. I think everyone's excited about this, and thank you all for being here.
Thank you.
Next item on the agenda is item number 5, land surveyors, with our own state representative, Matthew Cook. Welcome, Representative Cook. You're no stranger to the committee, and I think what you have here is a fairly simple item, and this didn't make it last year, right? And this is a redo?
Yes, sir.
Retry. I apologize for what happened last year. Hopefully that won't happen again this year. Proceed.
No problem, Senator Schickel. Thank you for having me, Co-Chairman Koenig. I'm Representative Matt Cook, representing the 72nd District. Let my guests introduce themselves.
I'm John Mark Hack. I'm the Chief Strategy Officer for Thoroughbred, a design, engineering, and construction firm based in Lexington.
And I'm Jerry Kissick. I'm the Director of Surveying for Thoroughbred Engineering.
And yes, Senator Schickel, as mentioned, we did have House Bill 526 filed last session, mostly just to get the word out. We know L&O likes to have everything vetted in the interim, and so we went ahead and filed it, showed everybody what we're doing. Kentucky faces a critical shortage of professional land surveyors. I know this. Many counties, such as Bourbon County, we have exactly 0, and that's county that's creating quite the backlog. Whether you're a farmer like myself and you need some land surveying done so you know exactly where to put the fence line in, or whether you're looking industrial sites, it's obviously extremely important for what goes on. It's always been an important part, no matter where you are in the world trying to get something done. But surveys are more expensive. They're taking much longer to complete because of this shortage. We simply want to create the option for the licensure board to develop a program that would be 2 years formal post-secondary education with 6 years experience in OJT. So this time I'll let my guests say a few words about it.
Mr. Chairman, I'd just say that the shortage of surveyors is real. As we've tried to grow our firm over the last 5 years, we've discovered that the pipeline is empty. As Representative Cook mentioned, in Bourbon County, where 20,000 people reside, there are no licensed surveyors. Same is true in Fulton County in Senator Howell's district, LaRue and Marion counties in Senator Higdon's district, and Owen in Senator Hornback's district. In Crittenden, Edmondson, Gallatin, Hickman, and Nicholas counties, all areas represented by members of this committee, there is one licensed surveyor in each of those counties. And the work that surveyors do, in case you're not familiar, is essential and critical to any land development purpose, whether it's a homeowner who wants to fence in her backyard to keep her dog safe, or a residential real estate developer who wants to increase affordable housing opportunities, or industrial development and economic developers across the state who are seeking to take advantage of the product development initiative that you all passed in the 2022 session. The shortage is creating delays, higher costs, and hardships on all of those parties. And this is just an option that the state board could take up to create a viable 2-year program in combination with 6 years of apprenticeship to enable more young Kentuckians who may not want to go through a 4-year college program to enjoy the viable career that land surveying offers.
Makes a lot of sense to me. Thank you for bringing this forward. Didn't this pass the House last session, or not?
It did not.
Okay, so we're okay. You, sir, do you have testimony?
No, sir.
Smart man. Is there anyone has any questions of our distinguished panel? Is there anyone in the audience that has a contrary view would like to speak? Okay, I missed someone on the panel. Representative Huff.
Thank you, Mr. Chairman. First off, I'd like to say I support this bill, and I'd like to see it passed, but I do have a question. Are land surveyors bonded or insured in case like they make a mistake?
Yes, they are.
So if they switch to the 2-year program, would they still be, I would assume they would still have to be bonded, or
carry errors.
Is
and
that the right
omissions.
word, bonded, insured?
Well, carry errors and omissions insurance.
Okay. Thank you, Mr. Chairman.
You're welcome. Anyone else? Representative Meredith.
Thank you, Mr. Chair. Just a brief comment. Appreciate the presentation. I know how real this is in my business as a banker. It's sometimes a 60 to 90 day wait to get a surveyor to survey a piece of land. That is really, really difficult. We're seeing shortages in all the fields, appraisers and everything else right now, but that's probably the longest wait time we run into is surveyors currently.
Thank you. Anyone else? Last call. Thank you all for your testimony. And lastly, we have number 4 on the agenda. Our friend Senate Leader Morgan McGarvey is here. He was scheduled to go early in the agenda, but with the time change, I know that was tough on your schedule, so we held you to the end, saved the best to last. And Anyone that is included in this testimony, please come forward. As I said before, we have a tradition in this committee where we don't testify to things that have already been testified to. It's good to see you all here. I'm sorry you had to wait. Introduce yourself for the record and proceed with your testimony.
Thank you, Mr. Chairman and members of the committee. Mr. Chairman, it is a pleasure to be back here in front of the Licensing and Occupation Committee. I'll let our guests introduce themselves, starting down here at my far left.
My name is Kenny Clark. I'm Nick's father and advocate for Christopher's Law.
My name is Nick Clark, and can you all hear me? Yeah. My name is Nick Clark, and I am an advocate for regulations and training for bouncers in bars and nightclubs.
Well said.
Lisa Wilner, representative from House District 35.
Welcome to this committee.
Thank you, Mr. Chairman. Given the rules of this committee, I'll be very brief. It's an honor to be up here with Christopher and to have worked with him and with so many legislators from both chambers and from both parties. This has been a bill in the past, most recently in House Bill 207 and Senate Bill 367. And with no further ado, I'll turn it over to Nick Clark to explain some of Christopher's Law.
Welcome. I believe you already did introduce yourself, so proceed with your testimony.
Well, thank you all for allowing us to be here today. Again, my name is Nick Clark, and I'm speaking today to address an issue around safety, specifically safety in our bars and nightclubs. My husband, Christopher, was murdered in January of 2020 by a bouncer at Nowhere Bar in Louisville. This bouncer was under the influence. He was never trained to be a bouncer. He has a history of domestic violence, and he was never background checked by the bar. Christopher lay on a cold January pavement, completely unconscious, no one attending to him. He went into cardiac arrest several times and later died at the hospital from blunt force trauma to the head. And one punch is all that did it. I'm speaking today about Christopher's Law, Senate Bill 367 and House Bill 207, which addresses the issue of safety in our bars and nightclubs. Just like our police force, military, firefighters, lifeguards, teachers, and basically any other profession has to have training, bouncers who are hired to protect the most vulnerable in an alcohol-driven environment do not have to have any training or special skills. Most are hired by word of mouth, physical stature, and through social media, which you'll see in the packet materials that were presented. Christopher's Law would require bouncers receive training developed by the Department of Alcoholic Beverage Control on de-escalation tactics, interpersonal communication, threat mitigation, and more. Just think, when your child or loved one goes to a bar, wouldn't you want bar staff to know how to manage crowd control, handle a bomb or active shooter, or talk to vulnerable patrons who have had too much to drink? I'd have to say that's a no-brainer. Christopher's death is not an isolated incident. As a matter of fact, bouncer abuse happens more often than you might think. I've personally connected and met with a couple families whose sons were murdered by bouncers who had no experience or training. In August 2014, Michael Gatto of Atlanta, Georgia, was beaten to death by a bouncer outside a college bar, and his family successfully passed Michael's Law in the state of Georgia. In August 2021, just last year, Dallas Barrett was murdered by 7 bouncers at Dirk's Bentley Whiskey Row Bar in downtown Nashville. And Barrett's family, he died of asphyxiation, and all 7 of those bouncers were indicted. Barrett's family also successfully passed Dallas's Law in Nashville in June of this year. Lastly, a city council member in Philadelphia was murdered by a bouncer with one punch at a bar in downtown Philly. Just Google bar deaths by bouncers and your jaw will drop. Bouncer abuse can be controlled. There's only good that can come from bouncers being trained to protect vulnerable patrons at bars. Each one of you has to have training or experience to do your jobs. I try to think of other jobs that don't have to have training, but I honestly can't think of any. And then also, please take time to review legislation in other states, including New York, Arizona, North Carolina, California, Tennessee, Georgia, and others, which are in your packets. But Christopher's Law has the support of over 20 representatives and senators. We have also consulted with many organizations for their review, support, and endorsement of Christopher's Law. Of the organizations we have worked with, include the Kentucky Restaurant Association, the Kentucky Retail Federation, the ACLU, Kentucky Trial Lawyers, and Craft Brewers Association, and we have made changes to satisfy their concerns. We've also gotten the endorsement of the Kentucky Association of Chiefs of Police. This has been a true grassroots effort. No lobbyist support or marketing firms have been supporting us. This is an effort by our family to make sure nothing like what happened to Christopher never happens to someone in the Commonwealth ever again. And then Senator Yates was actually supposed to speak here as well, but because of the special session called unexpectedly, he had to finish up business back in Louisville. However, Senator Yates actually has experience as a bouncer. While he was putting himself through law school, he worked at a bar in downtown Louisville and witnessed so many dangerous, violent incidents to the point he was concerned for his own safety. Senator Yates has also litigated many, many cases of bouncer abuse within his law firm. As stated earlier, bouncer abuse happens all the time, and they suffer no consequences or receive any training whatsoever. Not only do people die from power-hungry bouncers, assaults and serious physical injury occur frequently, and with Christopher's Law, we can put an end to this.
Thank you for your testimony. I appreciate you working with the committee. I believe this is the only PowerPoint that's ever been allowed in this committee that I've chaired, and I appreciate you you working with me on that. And you've been very, very patient and very thorough. Is there anything else? Do we have any? Yes. Proceed. Introduce yourself and proceed, sir.
Yes. First, I would like to thank Senator Schickel and the Illinois Committee for giving us this opportunity to at this hearing. My name is Kenny Clark, and I come before you today as a father. I have 2 children, a daughter, Sarah, who is married to my son-in-law, Mark, and Nick, my son, who was married to my son-in-law, Christopher McKinney. I could not be prouder of both of my sons-in-laws for the kind of men they are and the happiness they have brought to our family. Today, however, I'm speaking to you about my son-in-law, Christopher, who was killed by a bouncer at Nowhere Bar in January of 2020. Christopher was the kindest, most loving, and thoughtful human being you could ever meet, and our family is heartbroken and miss him every day. Please keep in mind that this could have just as easily happened to my son-in-law, Mark, in which case I would be here advocating for him today. It has nothing to do about being gay and everything to do about a bouncer that has been drinking, had no training, and had a history of domestic violence. Christopher's grieving mother and father, along with my wife, sit behind me today in hopes that something good can come from this senseless and preventable tragedy. We are all now on a mission to honor Christopher's name and memory by enacting Christopher's Law, which would require bouncers at bars and nightclubs to receive training and certification relating to their jobs so as to prevent another tragedy like this from happening to any other family. Thank you.
Thank you for your concise testimony. And first of all, I just want to extend my sincere sympathy on behalf of myself and this entire committee for your loss.
Thank you.
I can only imagine the pain that you're going through. This is very recently. I didn't realize how recent it is. And you're right about, I too, in another life many years ago, worked as a bouncer. There was a part-time gig when I was a police officer. I know that's hard to believe, Representative Flannery, but and you're right. They get thrown into situations, very dicey situations, with little or no training. You're very right about that. Do we have any questions from the committee? Again,
I'd like to add something,
Yes,
Mr.
go
Chairman,
ahead,
just to
Senator,
put a
please
point
do.
on it to wrap it up a little bit. And I so appreciate the diligent work of Nick and his father and family really crafting this legislation over a couple of years, taking suggestions from everyone, including from the retailers, from the people who own bars and restaurants, getting input, making this good, a really good law. Something this committee knows. I used to serve on this committee in licensing and occupations. There is far more regulation, licensing, oversight of someone who is giving you a pedicure, of someone who's giving you or cutting your hair. Think of all the different professions that come in front of this committee, and there's nothing related to bouncers. I'm a little bit different than Senator Schickel and Senator Yates. Believe it or not, I've never served as a bouncer. Yeah. Guess we're supposed to laugh so hard. But I think we all have experience in going somewhere where we've seen bouncers or we know of bouncers, and we know what they're asking for. They are asking for people to use physical force, who are able to use physical force on patrons in areas where there is alcohol. Yet we have no oversight whatsoever of what happens. That is something that needs to change, and it is something this committee can change. And it can change it in a responsible way so that not only it won't bring back Christopher, but it will keep it from happening in the future. And I encourage you all, I've been in a lot of these committee seats, and I know not everybody looks through their packets. Flip through this packet.
Yeah, I would encourage you to, and I did look through mine. Thank you.
Flip through it and just glance at the names and the faces of the people killed in all the other states, and the states like Georgia, like Tennessee, where their legislatures have done something about it.
Thank you, Senator. And now we do have a question. Chairman Koenig.
Thank you. I appreciate and want to echo the condolences, sincerest condolences on your loss. And Representative Wilner and I have discussed this more than once. In the packet, which I did look through, says, and it says so up there, approved by and made changes for. What does that exactly? Does that mean these groups have seen the new language and all support it?
Yes.
Okay.
Yes.
So, Restaurant Association, ACLU, Retail Federation, craft brewers, trial lawyers are all on board with new language and supportive of the bill.
Yes.
Mm-hmm. All right. Thank you, Mr. Chairman.
You're welcome. Thank you all for your testimony. Again, we extend our condolences for your loss. And thank you all for being here.
Thank you.
Thank you.
I believe that concludes our agenda. Does anyone on the committee have anything else? I know we have a full afternoon people have to get ready for. Very well. Without objection, we're adjourned.